So during treatment, one of the most important things in your exercise prescription is to really adapt your exercise around their therapy. So if a patient is getting therapy every 2 or 3 weeks, we need to really develop a training program that is specific to their therapy regimen. So we always talk about specificity and periodicity when we talk about an exercise program, whether it's for a cancer survivor or training for an Olympic athlete. But we need to develop that periodicity so it's around their treatment and we can optimize their end functional ability. So if we're talking about a patient who gets chemo on Monday, we can anticipate that 3 to 4, 5 days post-treatment is when they're going to feel their worst. They're going to have the most acute and intense symptoms, and those may be the days where they actually are advised to maybe take a rest day, maybe only walk 10 or 15 minutes in 2 different bouts. After a patient's been on treatment for several cycles, they begin to see an actual pattern to their side effects. The first time a patient gets their very first cycle of chemotherapy, it's very intimidating, it's kind of daunting. They're afraid they're not going to be able to walk out of the cancer suite. And then they don't know what's going to happen in the days after. But as patients go through more cycles of chemotherapy, they get a better understanding of what their pattern is going to be, what their side effects are, and when to intervene to reduce their side effects. So we need to help them to learn that, and we need to help adjust their exercise program around their side effects and their symptoms. And sometimes as patients go further through chemo, they may be understanding how to manage their symptoms better, but they may be developing new or worsening of side effects. And this is very common with peripheral neuropathy, for example. They may say, oh, I don't have any peripheral neuropathy. Now my hands and feet feel fine. And peripheral neuropathy generally starts at the fingertips and can progress up. And I've had patients where it comes up midway up their arm, and it frequently will come up midway up their calves, almost like a sock. With the worst neuropathy at their fingertips and a little bit more feeling as it goes up. But this develops gradually over time, over the course of getting, say, Taxotere after several weeks of receiving this. And so adapting that treatment to their new developing side effects is really crucial.